after a long time.
Sunil, Shankar has done his MD from JJ and DM from Science.
Yeah, I have his CV with me, sir. I have sir's CV with me.
6 years he is from in Mumbai.
Sir, we can understand you want to introduce him being your junior person of your colleague, but you are not audible here. The problem is you are not audible.
Hello.
Sir. I will do that job for you, sir. No problem. Okay, sir. His network issue, some issue with his network. It's okay. Usually we start, sir, 4:05, and I think now we can start in a minute. Peoples will join little late, and let's see. So Saturday afternoon, and that a lot of activities usually are going on. So let's see, like 30 people have joined. I'm hoping like 20 more, 50 around will be there. But important thing is that this topic is very important, and like from office practice view, I don't know a lot like. Usually if it's ventilation 100 people will be there, but if it's skincare is there, no, people are less. I don't know why this is. Everybody want to learn ventilation, neuroprotection. Eco, if you see there's a eco hemodynamic CM is there, then there'll be 300 people should be there. I don't know. Anyway, so we'll start like on now. On behalf of State NF Maharashtra, myself, Dr. Sunil, Secretary NF, I welcome you all the delegates here, participants, and Shankar Narayan sir. So today's topic is actually it's a very, very important topic. Those who practice office practice, neonatology, daily practice, OPD practice, they know the importance of this. A lot of things are taught during your training, like ventilation, as I said, neuroprotection, eco, nutrition, eco, everything is taught. CME is webinars. There's nothing like workshops or lectures. This is the most neglected part. And if you see the practice also varies a lot. Like for the same problem, dermatological newborn problem, you will see like 10 prescription, different drugs are prescribed. Personally, I found it's very difficult, sir. Personally, it's really difficult. Dermatology, newborn dermatology. So it's today. I was really waiting for these talks for a long time. So we requested you to consider this topic, skincare in newborn. I'm sure the delegates will have a lot of questions. If they are practicing, if they have questions, it's okay. Good thing. Like they will better to ask them and clear here now. And to address this, just to the formal introduction of Shankar Narayan sir, Sandeep sir told me, sir, he's a colleague, 1 year junior to you when they were in the Mumbai DM neonatology they were doing. So sir has done, he was I think in Maharashtra for a long time. So as sir said, it is like a ghar wapsi for Shankar Narayan sir. Anyway, long time now, but I think. Then after MD, DNB and DCH, sir completed his training in DM neonatology from Mumbai University. And after that, sir was in UK for a long time. So overseas, extensive overseas experience. And in Chennai, sir has worked in different capacity. And now sir is in Madras Medical College, a senior consultant neonatologist at Madras Medical. I'm very happy actually. This is one topic I listen throughout at least 45 minutes. Usually I just switch off the videos and video mode and I will go somewhere. But this time I'm going to listen this time. So word to you, Shankar Narayan sir, and hope we will have all practical tips. I expect routine newborn skincare. Lot on this topic, routine newborn skincare. What the parents do ask questions to us. Thank you, sir, and thank you for accepting this invitation and agreeing to speak on the topic, which is looks very simple superficially, but I know this is not a simple topic. Thank you, sir, and over to you.
Sunil.
Yes, sir. Yes, sir.
I wanted to just make 1 or 2 comments.
Yes, sir. Go ahead. Enjoy. You're junior. You can do again. You have chance to pull down him or ragging sort of thing again. Your residency days.
very few individuals that I know in my entire life who have got one of the best memories. And
Okay.
I have not seen anybody better than Shankar in terms of memory and intellect, number one. Number two, very, very thorough gentleman, always willing to help others. And number three, he has an insight into the subject which very few individuals in their have in terms of the knowledge and uh, the way he explains the thing and makes a complex thing look very simple. So that is what is Shankar Narayanan for all of us. Uh, he has stayed for more than 6 years in Mumbai, very close and near and dear friend who has helped me all along during my DM days. So without wasting much time, Shankar, on behalf of the state NNF, I really would like to thank you for accepting our invitation and giving a talk on such a difficult topic. And I'm sure we are going to be enlightened with your presentation. So over to you, Shankar.
Thank you, Sandeep. And expectations have already been set very high, so I will start straight away. Um, we can start with so this will okay. Okay, so that's me and that's my name. Okay, so this why is the so we'll start by asking why is the skin so important? Now, skin is of course the largest human organ, and we all know that it's a physical barrier, and it's important for thermoregulation. It's also very important for infection control. It's also a barrier for chemicals, and it also is a barrier for ultraviolet light, and also a barrier which forms an acid mantle. It's also an important barrier. It's also important for for the clinician, in the sense that a lot of clinical skills can be picked up by examining the skin. So diseases like anemia, cyanosis, cyanotic heart disease can be picked up by examination of the skin. Some clinical skills can be picked up by just examining one organ. The color of the skin can be used to pick up health as well as absence of health, which is disease. So sclerema, perfusion can be picked up. Warmth can detect either fever or good perfusion. Cold can pick up either a normalcy or can detect a lack of perfusion. So skin is very important organ. Um, Now, one of the first things which I was looking at, I mean, this was a very difficult topic, because often when I'm asked to talk about a topic, I'm asked to talk about something like cardiovascular system or respiratory system, but but I've never been asked to talk about the skin. So this was a very unusual topic, and therefore, but it is very interesting. So I thought I would take this as a challenge and read something about the skin, which is a very important topic. And when I did a Google search, the first thing which came up was this advertisement. So while we are in Maharashtra talking about how a baby is disadvantaged as compared to an adult, adults are trying to develop baby skin. So this is an advertisement from somewhere in the Europe, where adults are trying to develop baby skin by applying something. I mean, why would you do that? So very unusual. And then I thought, is someone in India trying to do this? And surely our Katrina ji in Bollywood, right in the capital of Maharashtra, is coming up with some kitchen recipes which will make adult skin into baby skin. So it's very interesting. And our Alia ji is also advertising a lot of products which will make adult skin into baby skin. So very interesting that here we are assembled on a Saturday, trying to see how we can make baby skin mature into adult skin, while the Bollywood celebrities are trying to make adult skin into baby skin. So, and it's not only the skin which is being sold which is in which we are differing from adults, from the Bollywood celebrities, but even in the cardiovascular system. So we have Ajay Devgan trying to make a movie about the cardiovascular system of a baby, the adult cardiovascular system into a baby cardiovascular system. So Dil To Bacha Hai. So he's trying to make the adult cardiovascular system into a baby cardiovascular system. I mean, this is just to break the ice. I'm a big fan of Ajay Devgan and as well as Alia Bhatt. So anyway, jokes apart, we are now moving into the aims of today. Um, what is the anatomy and physiology of the normal neonatal skin? That is one of the aims we're trying to find out. We're also trying to find out how the neonatal skin develops, how different the preterm skin is from a term skin, and how we should care for the term neonatal skin, and how we should care for the preterm neonatal skin, and some of the evidence-based care practices in neonatal skin care. And then, as always, the goal in neonatology is not just survival, but intact survival of the neonate. So as we know, this is how a cross section of the skin will look like. And again, we are going to go from the bottom here up to the top. So this is the epidermis at the top, then the dermis in the middle, subcutaneous fat here. And then these are some other parts which are not so important. So we'll in further sections we'll go further up the epidermis. So this is a cross section of the epidermis. At the bottom here is the basal layer, which is very mitotically active. The top layers of the epidermis is the stratum corneum layer, which is basically composed of dead cells. But this is where the preterm is quite different from the term. In the stratum corneum is quite few layers are present as compared to the term skin. We'll show in a few more slides. So this is a very useful diagram which shows the further layers of the epidermis. So this is the stratum corneum as we saw in the previous diagram. If you see this is the layers of the stratum corneum. This is the term baby's stratum corneum. In a preterm baby, it has got only few layers of the stratum corneum. Now, if you use an occlusive dressing, it damages so occlusive dressing as in the tapes, the micropore, the ones which are very sticky tapes, they will damage the stratum corneum. So it becomes something like this. The occluded stratum corneum, the lipid layers all get disrupted. So they become something like this. So these should be the occlusive type of dressings will damage the stratum corneum. So that should be avoided. Now, if you use irritants like the very strong disinfectants, they will damage the lipid layers in the stratum corneum. So they will cause disruption, somewhat like this. Now, if you have applied its tape and if you suddenly strip it out, it will cause damage to the stratum corneum. So the layers in the stratum corneum will get removed like this. Now, if in a preterm, if you apply a tape and remove these two layers, you're straight away going into the deeper layers of the epidermis. So that is why in a preterm, never apply occlusive dressings. And if you are going to remove the tape, always do it very, very gently. So this is the important diagram. So preterm, very few layers of stratum corneum. Occlusive dressing will damage the superficial layers of the stratum corneum. Use of irritant chemicals while cleansing the skin will damage the stratum corneum. Using tape or removing it very quickly or using a quick motion to remove the tape or even removing it even slowly will damage the stratum corneum. So always remove tape after applying some saline. Do it slowly, otherwise it will cause damage. So as a major distinctions between preterm and term skin is that the thickness as compared to a child or adult, the preterm skin is thinner, epidermal thickness is less, stratum corneum is much thinner as compared in the preterm as compared to term skin, and as compared to a child or adult, the stratum corneum is thinner. So preterm, thinner skin, thinner epidermis, and also thinner stratum corneum. So in development, so the preterm is of course not one entity. The preterm, the more immature the preterm, the more immature the stratum corneum is. So in the first, the stratum corneum is maybe about 15 layers, but in the very preterms, like very extremely preterms, like the 23 weekers may have only 2 or 3 layers. So not only the stratum corneum, but also the cohesion between the epidermis and the dermis may be damaged. They might have less collagen. So this might result in marked increase in transepidermal water loss and resulting in less skin integrity. So this is one of the, so the skin might just peel off in the extreme preterms, especially in the 23, 24 weekers. So this is one of the major developmental handicaps which we see in the extremely preterm babies. So this is one of the major things which we see in the extreme preterm babies. So this is the anatomical handicap which we see in the preterm babies. Next, we come to the vernix caseosa. The vernix is a hydrophobic material which is the lipid components with water. It has got a moisturizing effect and is also a mild cleansing effect. It is present mainly, is less in the preterms and the postterms and also in the IOGRs. And the general feeling is our people feel that it looks dirty and therefore we should remove it. But it's a good thing, and therefore our advice is that it should not be removed. So leave it on as much as possible. So vernix caseosa is good, don't remove it. Leave it on for as much as possible. Now, sweat glands develop in term neonates, and they usually develop around the first 2 weeks. Sweat glands develop later in preterm infants, and because sweat glands help in dissipation of heat, in term neonates, they're an important mechanism of thermoregulation. And in preterm neonates, because they can't lose heat by sweating, they can be an important source of in which they can retain heat, and therefore they can be a handicap in their inability to lose heat. Preterms and thermoregulation. So preterms can lose a lot of transepidermal water loss. The reasons being that they have a large amount of they have one is because they have a high body surface area. They have a high dermal blood supply. This, as we have already discussed, they have a very thin stratum corneum. They have a very thin skin. The skin damage results in high water losses, and therefore the skin protection is very, very important. Further, the skin pH in infants is about 5 to 5.5. In the neonates, it's more acidic. The more towards the neutral to alkaline pH, because amniotic fluid is more alkaline. Acid mantle helps in the barrier maturation and the skin defense against protection against infection. Skin microbiome contains various good bacteria, and this is it contains various microflora, and this will help protect against the development of harmful colonization by harmful organisms. So in summary, epidermis of a neonate is thin, epidermal attachment is less, the lipids are less, the sweat less, the water content is more, the pH is more, and the transepidermal water loss is more. As opposed to this, the infants have have a thicker epidermis, and in general, they are able to regulate their pH and also their transepidermal water loss better. So Next, we move on to the skin care of babies, and we have this A, B, C, D, E, F, G, H, and we'll discuss this in a bit more detail in the next few slides. So the assessment is of if you use this acronym, we can discuss this in a bit more detail. So the assessment is daily inspection and assessment. So we look at daily the dryness, erythema, and also breakdown. So the daily we look at the dryness in terms of whether it's normal, whether the dry skin is visible, whether it's very dry skin or with cracking or fissures. Second thing is whether there is erythema, whether it is visible erythema, or whether there is breakdown, which is either no breakdown, small localized areas, or extensive. And we give a score of 1 to 3 for each, with scores of 0 being perfect score is 3 and the worst score is 9. Okay. Now, the common questions asked of us are, should babies receive bathing and how frequently should baby bathe? The first thing is, when should babies first have their bath? And the answer is, for a term baby, bathing can wait for first 4 to 6 hours. So if bathing is done too early, then one thing is they can get cold, the breastfeeding is delayed, and therefore there is a risk, and therefore there's no need to bathe them in the first 4 to 6 hours. They can get hypothermic as well. Next question is about how often should preterm babies be bathed? And preterm babies generally about 2 to 3 times per week is more than enough. There is no need to bathe them more than that. Frequency of bathing is now every day versus every 4th day. Now this is for preterm babies. The question is about, should we bathe them every day or every 4th day? And the questions are about, what is the difference? So one question is does bathing every day decrease the risk of harmful bacteria colonizing the skin? And various studies have been done, and they've shown that there is no difference in the incidence of colonization of bacteria. And in fact, the risk of hypothermia is less when preterm babies are bathed every 4th day instead of every day. So therefore, for preterm babies, it may be better to bathe them every 3 or 4 days instead of every day. And in fact, hypothermia is much less when they're bathed every 4 days. Now, other question which parents ask is, should we bathe them in a tub versus bathe them with a sponge? Now, when you bathe them when they're bathed in a tub, when they're bathed with the sponge as opposed to a tub, with a sponge, there is a risk that they are exposed to the atmospheric air, and therefore they can get hypothermic. So therefore, bathing in a tub, there is a risk of hypothermia is less. Then there is whether a wipe using a wipe as opposed to a may be better, but again, wipes may be irritant, and therefore there's not much benefit of using a wipe. Again, parents often ask this question: should we use a soap, and what soap should be used? I try to ask parents, why do you want to use a soap? And the common answer which parents give is that the complexion will be better. And that is the reason why our parents often want to use soaps. Really we don't understand what better complexion is, but whatever that means, soaps do not change complexion. So really we should not be recommending soaps for changing complexion anyway. Soaps can harm newborn skin. They can cause irritation, and they can cause dryness. According to at least the Western studies or Western recommendations, there's no need for a soap till 4 to 6 weeks of age. The best recommendation which we can use is use a little soap which does not cause any lather or does not cause any bubbles to form. Liquid soaps are preferred over neutral or acidic. So you better use a liquid soap and use only a little bit, and use a little bit of soap especially in the groin area or the armpits. And so don't use too much soap. And that is the best recommendation. Do not use too much soap. Use only a little bit. Use a little soap, and so that it do not cause much lather. And neutral soap or acidic soap is better than alkaline soap, and that is the only answer which we can give. And no soap till 4 to 6 weeks. That is the best recommendation possible. Baby powders. Again, the reason why our parents want to use baby powder is to improve complexion, whatever that means. Again, there is no benefit of using baby powders. It does not change complexion. It is not helpful. It can be harmful because it can cause blockade of sweat duct pores. There is a risk of inhalation. We should strongly recommend against the use of sweat duct pores. At least according to some news items coming out of the West, there is a risk that baby pores can be harmful. Therefore, baby powders should be avoided as much as possible. Cord care, the recommendation is that keeping it dry is the best recommendation. There is no need for use of any antibiotic powder. Routine application of alcohol is not recommended. The base of the cord should be examined, and that is all is necessary. There is some evidence that use of chlorhexidine can reduce neonatal mortality where there is high NMR, and therefore this may have implications in some settings. But as of now, what we are recommending here is that keep the cord dry is the only recommendation we are doing. Then dressing of the skin, where we are doing surgical procedures, we are using occlusive non-adherent dressings for partial thickness wounds. So we are not using adherent dressings at all. We are using non-adherent dressings. For all the wounds, we are using cleansing by normal saline only. And then where there is pressure, we are using change of position. So these are the important things in preventing any wound injury. And then this is another important thing: the hydrocolloid dressings, or what is called deoderm, which is the trade name by which it is being sold in India. This is a picture I got off from the internet on the various sort of shapes which are being available for use for the CPAP prongs. So when they are used for the nasal septum, for prior to nasal septum, for the underside of the nose and for below the nose over the lips, prior to application of the CPAP prongs, they can reduce the pressure which the prongs and the mask can apply on the nasal cavities, and can reduce the risk of nasal injury caused by the interfaces. And therefore this is from a study from Taiwan, and we use it a lot for we use a lot of deoderm for babies who are on CPAP, and this can reduce the risk of injury due to the pressure of the interfaces, especially when a tight seal is required to maintain the pressure of CPAP. So hydrocolloid dressings are non-occlusive, but they allow the tissue underneath to breathe and also to epithelialize. When the tissue, when it has to be removed, it can be removed without damaging the skin underneath. So next slide. This is a sort of a deoderm which has been applied to a mannequin, and this is for an umbilical arterial bridge. So this umbilical lines have been cited. So if you apply this sort of dressing directly to the skin, when you remove it, it will damage the skin underneath. But if you apply this sort of a hydrocolloid to the skin underneath is intact. It can epithelialize, and when it epithelializes, the fluid underneath can remain, and this sort of bridge can be placed on the top of this deoderm. The lines are cited. This this sort of sticking can be placed on top of this hydrocolloid when it can be fixed together. So when the lines are ready to be taken out, the lines are removed along with this deoderm, so they come out easily, and the skin underneath is not damaged. So hydrocolloid dressings provide a moist environment which allows the body enzymes to help heal. They are impermeable to bacteria, and they do not stick to the wound, or flexible to mold around the skin and body motions. So we use it a lot um, to avoid damage to the underlying skin in areas where we need to use the adhesive dressings to secure the lines, but we also need the hydrocolloid dressings to prevent direct contact with the skin. The next thing is emollients. So emollients are moisturizing agents to prevent evaporative losses. So we have creams which are oil based, and ointments sorry, creams which are water based, and ointments which are oil based. So we can be now vegetable based, or which is coconut oil, or soy oil, or safflower oil. Emollients can also be like dye. There should not be any perfumes or dyes or preservatives. Now, oil massage has been used in developing countries for a very long time, and in fact, in India, it has been very traditional for a very long time. In fact, our grandmothers have used oil massage very for generations together, and it's very difficult for them to get away from that practice. And surprisingly, many of our studies have shown that it has actually been beneficial to both in terms of neurodevelopment as well as in terms of weight gain. And this was one of the studies published, which we published in 2005, where we showed that weight gain was actually beneficial, was actually higher in babies who had coconut oil massage as compared to a mineral oil massage. It's not only the oil as such, but also the massage and touch, which make a difference, as has been shown in subsequent studies as well. So therefore, emollients have a role in in not only keeping the skin moist, but also the touch and the massage have found to be beneficial in one, in weight gain, as well as in long-term neurodevelopment of the neonate. In developed countries, though, there have been conflicting reports, and some have found higher incidence of invasive infection, although there have been no difference in mortality, and therefore there have been suggestions that further studies are needed. Okay, in preterm infants, there are some studies which have shown that coconut oil may be beneficial. In preterms, we have an increased transepdermal water loss, and our aim is to reduce the transepdermal water loss, and so as to maintain the fluid balance. So use of antenatal steroids, oil application, and incubator for less than 27 weeks gestation, as well as use of humidity can help in maintaining the fluid balance. Now, antiseptics. The two antiseptics are commonly used in preterm infants for cleansing the skin. Now, we use either chlorhexidine or povidone. Now, povidone as an antiseptic, the risk is that now, because the stratum corneum is very thin, there is a risk that this iodine itself may be absorbed. And in fact, many studies have shown that a lot of drugs can be absorbed very easily from the very thin skin. Chlorhexidine, if left on the skin, can cause significant burns, and therefore chlorhexidine has to be applied to the skin. After the contact period, it has to be washed away with sterile water. So chlorhexidine can be used, but after it has been applied for about 30 seconds, it has to be wiped away with sterile water, and then the procedure can be done. Therefore, chlorhexidine is the preferred antiseptic. Povidone, if there is no alternative, but even if povidone is being used, apply it for a period of 30 seconds and then wipe it away with sterile water. There is a risk of systemic absorption, especially the smaller the preterm and or more immature the preterm. So again, that's what we said in the previous slide. The chlorhexidine is a better option. Povidone is a risk of systemic absorption and hypothyroidism. So humidity reduces the risk of transepidermal water loss. Our aim is to maintain humidity of 60 to 80%, which reduces the fluid requirement and minimizes hyponatremia. So in the delivery room, use soft sheets, remove the blood and meconium, and don't remove the vernix. As I said, vernix is helpful. It is both cleansing as well as protective against, it is an emollient as well as a cleansing agent. Don't remove the vernix. And if you rub too hard, this is what will happen. Don't rub too hard in the delivery room. So in the delivery room, the important thing for maintaining temperature is to warm delivery room, preheated linens, dry and cover the head, rapid resuscitation and transfer to the delivery room, and humidification of the gases. In the preterm neonates, plastic wraps are another important thing. So this is a cling wrap. Now, common questions which come around cling wraps are, what are these cling wraps? This is actually food grade plastic. So these are not very expensive plastic. So you can use plastic cling wraps. So as soon as the preterm baby is born, so the plastic is the plastic is spread out on the warmer. The baby is delivered onto the radiant warmer, and then the wrapper is covered onto the baby. This is done before the baby is dried. So there is no need to dry the baby and then wrap, because our aim is not to. So there is no need to dry the baby and then wrap it. So immediately after the baby is put on the radiant warmer, cover it up with the cling film. What is being used is the cling wrap. Is a food grade plastic, so it is very cheap. Then full resuscitation can be done. A small hole can be cut into it if umbilical access is needed. Baby is taken along with this into the NICU. Once the baby is stabilized, the umbilical lines have been put, the incubator has been warmed up to about, and the humidity has been set to about 60 to 80 degrees, and the temperature is up and running. Then this plastic can be removed. Some may leave it for, if baby is going to be nursed in a radiant warmer because of non-availability of an incubator, then this can be left till for a further period of time. The important thing is not to dry the baby and then apply this cling film. Immediately after the baby is born, as soon as the baby is brought to the radiant warmer, wrap it up. That's the important thing. And studies have shown that it reduces the risk of hypothermia. Best effects are seen in babies below 28 weeks. Effects on babies below 32 weeks have not shown any particular importance, but in low resource settings, it may have benefits. So again, important things: adhesive removal. Always use normal saline, especially in the preterm babies, before attempting removal. Be gentle. Use hydrocolloid dressings, and always try to do teaching and training of especially of the junior staff, and removing of the tape especially should be done very, very gently. Then skin microbiome, we have good bacteria. The skin pH is low. There is resident microflora. Skin microbiome is changed not only because of the resident flora in the NICUs, but also because the baby receives various antibiotics. Remember, baby also has a scalp which has hair. So baby shampoo can be used to remove crust, use minimal time of contact. Baby can have use of mineral oil. So then this is another thing. The diaper dermatitis, very common in India because diapers are relatively new to India. This is because one, there is a large, moist, occluded environment. So direct contact with alkaline urine and stools and attacked by microorganisms. So one is the the diapers are super absorbable, but once these rashes develop, the reaction of our parents is to use the cloth diapers, which make the thing worse because they don't absorb the water at all. So clean with soap and water. Avoid vigorous rubbing. So one is clean and then allow it to dry. So allow it to dry and then apply the diaper. So once it happens, clean it, allow it to dry, and then apply the diaper. So what happens is, what our parents normally do is clean it, when without allowing to dry, apply a new diaper, and sometimes they apply a cloth diaper, which makes the wetness even worse. So use a diaper which is super absorbent, but dry it, allow it to dry, and then apply a new diaper. So babies in NICU are vulnerable because toxicity happens from skin disinfectants, damage from pressure injuries, and then stripping from medical adhesives. Okay. So plastic wraps, as we discussed. Okay. So this is a pressure sore. Now this has happened because baby has been left in working position for a long time. Now this may have happened because this baby has been particularly sick and could not have been moved because of various procedures being done. But the important thing is to monitor use of a padding, change of position. Now, baby may have had various problems, but important thing is we should not forget the skin, which is the most important organ, which is the largest organ. So always we are worried about the respiratory system, cardiovascular system, but we forget the largest organ, which is the skin. We remember to monitor the respiratory system every 4 hours with a blood gas, but forget that the skin, which is the largest organ, needs to be monitored at least every 6 to 8 hours. And then monitor all tapes. Other thing is extravasation injuries. These are happen because something like inotrophs have extravasated. So immediately elevate the limb, wash with saline, use an hyaluronidase 0.2 ml locally within 12 hours, and then dressing with chlorhexidine. So in summary, the skin care is an indirect indicator of the quality of nursing care. And then nursing care doesn't mean only the quality of the nurses, but also indicates the quality of the nursing care provided by the doctors. Assess and monitor, and then healthy skin is very important key to good outcomes. And then a few points. Remember, it's important to have a holistic care. When you're going off a shift and you want to tell your boss that you're going to finish your shift and therefore you're going to report a normal blood gas and then go off, remember that you're going to prick a normal skin. Damaging a normal skin to report a normal gas comes with its own risks, because you're going to damage the skin, which may introduce an infection or be a precursor for some other problem. Quick IV line. So if you want to quickly do an IV line, then if you want to do something quick, you may not get it in time. So you may damage the skin. So again, or you may rub the skin too very fast. That may damage the skin. If you want to quickly remove the UVC, then you may quickly remove the tapes, which may again damage the skin. So if you are not sure about the abdomen and therefore you want to start IV fluids, again, take your time to make a decision, because if you make a decision in haste, then something like starting an IV fluids may mean putting an IV line, and again that is a risk for damaging the skin. Again, what I'm trying to say is, any decision we make in an ICU is something which can have an effect on the skin, and anything which affects the skin causes an effect on other organs as well. So if you make a decision like, decide on stopping the antibiotics tomorrow instead of today, when you can make a decision today, then it can have an effect on the skin microbiome today. Then again, is a risk. So what affects the skin affects other organs, and what affects the other organs also affects the skin. So everything is connected, and therefore, if you look at damage to the skin, releases a lot of cytokines, and the cytokines can cause risk for BPD, and the cytokines are also risk for periventricular leukemalacia. So everything is connected, and therefore, as we said in the first slide, our aim is not to have an intact survival. Is not to have just a survival, but to have an intact survival. And therefore, मेरे पास ventilator है, high frequency है, nitric है, it's not particularly useful. But what we need is मेरे पास holistic neonatal care है. And therefore, those who have watched Diwar will note that the survival was better for Shashi Kapoor. So what we learned today is that anatomy and physiology of neonatal skin, and that the preterm neonate is at a big disadvantage as far as the anatomy and the physiology of its skin is concerned, and that the differences are particularly more difficult because of the various procedures which are being done for the preterm. We also learned that many of the procedures which we do for the preterm make it more vulnerable to infections, and because the preterm is at a risk for various long-term neurodevelopmental as well as various long-term complications, we need to pay particular attention to the skin as well. If one lesson learned from today is that you will always think that the preterm has a skin, and if you think that by doing this, am I going to harm the preterm skin, then my talk for today has been worthwhile. And we also talked about a lot of evidence-based practices in neonatal care, like the use of chlorhexidine for skin care, use of cling wrap, use of humidity in the incubators, use of not using soap till 4 to 6 weeks of age, and not using powder for preterm babies, use of coconut oil as an emollient. And just to reiterate that our goal in neonatology is not just survival, but intact survival of the neonate. Thank you.
Thank you, sir. Sunil here. It was excellent, very clear-cut messages, and definitely now, at least after this lecture, I know those who are listened to your lecture, they know the importance of skincare, and now they can, every time they write the progress note about like the ventilations or respiratory, there's one more organ should come in the progress note, is the skin care and how the skin score. As at the beginning, we said, this is a very important topic, neglected, and there will be a lot of doubts. So there are questions for you. I will just read out it for you. Dr. Bhavya is asking about neonatal soap. Other than pH, what ingredients are to be avoided? Sir, please, and these are parents usually ask about this question. So she is asking about the practical tips, like if there are some 5 important brands, how to select apart from pH, and practically, like if you're sitting in the OPD, somebody asks when you're writing the prescription about the soap, how you decide, and what are the basis of your decisions, like this soap should be used.
Okay, 1 minute. Where am I? This one.
Chat box.
Chat box.
So practical points while selecting the soap, sir.
Okay, so practical point is, one is don't use soap till 4 to 6 weeks of age.
Okay.
So don't use soap till 4 to 6 weeks of age. There's no need for soap. Second thing is, use a little bit of soap. Our parents often say which soap. It doesn't matter which soap, but use only little bit. Um, the third point is, use a little bit so that only a little bit of foam comes out. The other thing is, dilute the soap. Dilute the soap with water so that only little bit of foam comes out. That is the only thing. There is no need to use. If they use a lot of our parents, what they do is they use the soap and rub it on the baby's body. That is the thing which causes the harm. So use a little bit of soap, rub it. Use a liquid soap, put it on your palm, little bit, dilute it with water, then so that it forms a little bit of foam. Use it for the groin, use it for the armpit, rub, and then form a little bit of lather. That's all it forms. That's all is needed. Don't use too much. That is the only thing required. All the other brands are similar in all brands are similar in nature. The only thing I can say is, don't use an alkaline soap. Use a neutral or acid soap. That's the only thing. There is no big difference between the various brands. They're what is the big difference between X, Y, or Z brand? There's no big difference. The only thing is, use a neutral pH or a slightly acidic pH. There is, but what will make a difference is no soap for 4 to 6 weeks. Use a little bit of soap and use only a little bit of foam. That is important.
So what about this? There are something like syndics, something bars are there, soaps are there. What is the difference between these?
And also liquid soap, little bit.
No, I was just asking, like, if you see in the market, there are bars are there, syndate bars are there, and there are some soap, and now you said liquid soap. So
liquid.
Okay, so go for liquid.
Liquid.
Okay. Okay. Fine. She's again asking about non-adhesive, non-occlusive products. Please give an example of non-adhesive, non-occlusive products. If it is non-adhesive, how does it stick to the skin?
So I'll share this. 1 minute. Now it's better. I'll share this. So it's okay. Someone is interested in this deodorant, that will that they can click on this link, and that will have a lot of information about how it sticks and all that. But that's a good one. There's a lot of information, but that's how it works. And you can also read up about so they can also read up about how to fix umbilical lines using this deodorant. This is from somewhere in Australia. So they are showing pictures of how to do it. So that will be very good. So the mechanism is less important, and the practicality is quite helpful there.
Suraj, you asked about meningocele or post-operative wound dressing. Post-op wound dressing. Do you recommend only normal saline wash? What type of dressing is useful? Occlusive or non-occlusive?
So meningocele.
Or post-op dressing, wound dressing.
See, post-op becomes much more complicated. I'm a medical person, so post-op the dressing is done by with saline. The dressing is cleansing is done with saline. Now, what is applied on top of it is often decided by the surgeon. So we leave that to the surgeon. They often use what is called the tulle. So I'll show you what is what's a tulles. So they use this tulle and so they use this tulles and leave it on the for covering it. So and then they put a bandage. So each surgeon depends on what they want. So it has some antibiotic impregnated into it. So now that we don't get into what the surgeon wants for each one of these, but that's what they want. So they want a antibiotic impregnated tulle. That's what they want for the post-operative uh, wounds.
Okay, sir. At the same time, Dr. Suraj is asking about provident iodine which you use for skin preparation. How much is too much in extreme preterm?
Povidone iodine we can use, but use a little bit. I mean, it's very difficult to see. Just use it. Apply for it it needs a contact time. So the contact time is for 30 seconds. So if you're applying for the umbilical lines, just cleanse the skin surrounding the skin. After you applied for 30 seconds, then use saline to wipe it off. Don't leave it there. So what we do is for umbilical lines, we clean the skin. Once we have applied it, we just leave it there. So don't do that. Apply after the contact time is finished, clean it off with saline. So don't leave it there because povidone iodine can get absorbed, and more than that, it can also cause burns. So after the contact time is finished, its effect is gone. It has killed all the bacteria. Remove it off. That's what the important thing is, to not leave it there. So if chlorhexidine is available, that is better. But if it's not available, if you have only povidone iodine, apply, but after 30 seconds, wipe it off.
Okay, sir. Dr. Bhave is asking, your study about in IP about coconut oil application has shown that short-term benefits are there about coconut oil application. Any recent updates in massaging and oil application on long-term benefits?
I'm not aware of any long-term benefits. I'm not sure.
Sir, like if you're doing oil massage, even in the summer, we have to continue same thing?
In Chennai, we have only 3 seasons: hot, hotter, and hottest.
Okay. So we have seen like a lot of babies, they get sort of milia like eruptions if you apply too much of oil and if it is a hot season or it's sweating also. So that's why I asked, like, is it like same thing they have to continue when it is hot outside? Anyway, as you said, in Chennai, it's only hot. So still, just I was asking that. But this is what I observed.
Yes. In Chennai, we apply routinely. We have no problems at all.
Okay, sir. Fine. So, sir, why do you avoid scented products? Is it irritant or is a part of developmental supportive care? Does it affect the neurodevelopment?
I don't think it's anything to do with neurodevelopment. Scents are, it's an added chemical. It's an added chemical, and which may have, is an added chemical which may have its own. One, it may have an irritant effect. Second is it may have an allergenic effect also. So we don't need anything which is not needed, and that is the only reason why we are saying don't add a scented chemical.
So that is what is it? Whatever the irritant, avoid it.
Okay.
Okay. So this is a part of neurodevelopment. If you use like breast milk or something soothing smell, so that can help with the neurodevelopment. Dr. Suraj is asking about, if baby shampoo, what ingredients are harmful? Is it recommended for cradle cap?
For cradle cap, we are using shampoo, normal baby shampoo. We are advising normal baby shampoo. We are not advising any particular shampoo unless it's an extensive baby shampoo. Sorry, extensive cradle cap. Um, so for normal, for mild types of for mild types of cradle cap, we advise using um, baby shampoo. No specific no specific brand names are advised, and we use them. We advise parents to use it, and then um,
Okay. So again, there's a question like normal size diaper is a problem for ELBW. They are saying. So the problem is availability of diaper which are extreme for extreme ELBW. Are you getting, sir, there at Chennai? You're getting very small size diaper there for ELBWs, less than 1,000 grams diapers.
Chennai, Chennai is not a problem. Here we don't have a problem. Chennai, we are not having a problem here. But in some places we're actually having to, we have heard people having to cut the diaper.
Yeah. So you have to cut it, and like, but many places in the cities, they diaper like very small size diaper for ELBW are available. Like, but I don't know, like some people they are finding it difficult to get that diaper anyway, so they can contact the company people. Sir, do you practice hyaluronate injection for IV extravasation in your unit?
We have not had a problem so far. Um, we have the facilities, but we've not had a problem so far. I don't know whether to be happy or sad about it.
Yeah, you should be happy,
But
sir.
probably happy, but we've not had a problem so far.
So what severity of extravasation is preferred? Nothing. Okay. So Dr. Anju John is asking about from where we can get hydrocolloid dressing. Okay.
Hydrocolloid dressings are easily available. Hydrocolloid dressings are, the duoderm is easily available.
Okay. Dr. Sonali is asking about stoma care. Stoma skin care, like maybe post colostomy or something like that. She's asking to guide a little on best stoma skin care. Like once their colostomy is there, how to take care for a long time at home.
This is something I don't know from here. Probably someone from Mumbai can help out. Chennai, usually the surgeon knows the best person. I'm not sure of how to help out from here. Sorry about that.
And we'll go for next question, sir. Bhavya is asking, can we use moisturizer in neonate, and how to choose ointment, lotion, cream? Any science behind it?
Okay. So moisturizer can be used. Moisturizer is actually the same. People often ask, is there a baby moisturizer? Is there an adult moisturizer? Moisturizer is moisturizer. There is no baby or adult. So moisturizer can be used. The thing is, especially in places like Chennai, it is very humid. Mumbai is not so humid. Chennai tends to get very humid. So when it's very humid, the moisturizer tends to make it even worse. But in when it's not very humid, moisturizer can be used. It tends to keep the skin moist. So when there is dry skin, moisturizer can be used. I'm not recommending on whether moisturizer can be used in all babies or not. I don't think that is the question you're asking. Can you're probably asking about, can moisturizer be used for a dry skin? I'm talking about in that context. So moisturizer can be used in a baby with a dry skin. Moisturizer can be used, yes. So the cream is a water-based one. So for the milder varieties, the cream is used. For more severe cases, the ointment is used. The ointment tends to be oil based, and they tend to stick to the skin much more intensively. But the important thing is that they also make the skin more oily, so they can stick to dress, and they can make the skin more messy. But if you use in places like Chennai, where it's already very humid, it can be make the babies very uncomfortable. So you have to make these decisions looking at various things, not just one thing as such. So these are some of the things which you should look into before you make a decision on which one you are going to use. So
Gaurav,
um,
Gaurav is asking sir about liquid soap. What like type of liquid soap, and please specify brand name if possible.
multiple liquid soaps are available. There is multiple are available. Every brand has a liquid soap, so don't I don't want to get into naming a brand. um, Type in Google, you will get multiple names.
Okay, sir, no problem. Suraj is asking, sir, how to prevent scar once the nasal injury has occurred? Any evidence-based thing like cannulate or calendula ointment for nasal injury?
See, once superficial injuries will not lead to scars, but deeper injuries will lead to scars, and none of these ointments will really prevent formation of scars. And that is all is the evidence. Um, many of these Many of these creams are meant for superficial injuries, which will not lead to scars anyway. Um, the deeper injuries will lead to scars anyway.
Bhave is asking about, sir, your experience in treating infantile hemangiomas.
Okay, so the infantile hemangiomas, the if you are looking at the the smaller varieties, like again, um, is a very large topic to answer in a few seconds. If you're looking at the milder varieties, they go away without any treatment. The more extensive ones require a lot of are multiple in there are multiple treatments available. I've had the minor ones which have grown, which have stopped growing, and I've had the severe ones which have responded to propranolol, and they have had the more severe ones which have not responded to propranolol as well. So the extensive ones are available. One of them have even gone on to steroids and not responded to that as well. So it's a very vast topic to talk in a few seconds.
Okay, sir. Aarti is asking, Dr. Aarti, regarding umbilical sepsis. With umbilical pus oozing, besides treating sepsis, what local application is best for umbilical site? Pus oozing from umbilicus.
Okay, so if you are giving something systemic, some antibiotic systemically, that will be enough. There is no need to apply something locally. If there is a there is no need to apply an antibiotic locally if you are giving a systemic antibiotic. If there is a localized abscess which needs drainage, then that will be helpful. But there's no need to apply something locally as well. Now, only thing to keep in mind is that there may be something like a rare conditions like an urachus or some fistula, which you may need to look into carefully to see if that is the reason. But those are very rare conditions. So the quick answer to that is, if you're giving a systemic antibiotic, there is no need for a local antibiotic.
Okay, Dr. Suraj has said that uh, certain physiological variants are treated with Calosoft lotion for satisfying, but does it have any adverse effect on the implication of skin? Calosoft and its adverse effect he's asking about on skin. Calosoft.
Okay, good. It can be satisfying. Yes, good. No, I think it's okay. Like you have to give something.
Okay, sir. Then there's appreciation, like they're appreciating your lecture. Excellent lecture, sir. Like now a lot of questions, non-specific, like mosquito bite. So okay. guides us on the managing scalp pressure source, sir.
The scalp pressure source, the important thing is to prevent it. I mean, these are very scalp pressure source should not happen if change of position is a routine thing in the unit, and baby should be changed in position, and babies no, frequent change of position. If that is a sort of a routine in the unit, nurses should be frequently, training programs should be in place. Then those things should not be managed. If it does happen, then local application of they make sure that if the local infection is treated, keep that area away from pressure, application of again keeping that area dry. These are the preventive measures which can be done.
Bhavi is asking about how long a diaper can be used overnight. Better to change it once it's wet.
Yeah.
Then Dr. Nasa is saying that port wine stains are noted since birth. Is any treatment required for that, or any skin changes we have to be aware of that? Port wine stain.
Port wine is good. Port wine stain will go away.
Shreya is saying that it was very good informative lecture, sir.
Thank
So
you.
that was the last question and last comment, sir.
Okay.
Yes, and that ends our question. Dr. Anjali is saying thank you, sir. Excellent lecture and very informative. So really, it was informative, sir. And as I know this is never-ending story, like dermatology, neonatal dermatology. It's like very non-specific. Dr. Sunil is saying from Hyderabad, excellent talk and lecture, sir. Bhavya is saying thank you. Praveen is saying it was excellent lecture, sir. So really excellent. We enjoyed it, and it's more of interaction. Today it was more of interaction. So thank you, sir, making it more of lively and interactive. And it is definitely going to help everyone practice about skincare and their doubts about skincare. Thank you. Thank you for accepting sir, our invitation. Thank you, our background team also. Ganesham is there. Mr. Ganesham is there from KM. Dr. Sandeep, sir, I think there was a problem with his network.
Sunil, I am there. Sunil, I am listening.
Sir is there. Sir, your words, sir, last words from you.
Shankar, as always, excellent presentation.
Thank you.
And
Thank you.
you have touched on all the aspects of skincare. And I'm sure a lot of our people would give respect to skincare in newborns, especially in preterm babies, because it is the largest organ. And I'm sure we would all give a lot of importance to this organ from today. Thank you for accepting our invitation. And we look forward to now having you back in state of Maharashtra.
Yes, sir.
Thank you.
Yeah. Thank you, Sunil.
Thank you, sir.
Thank
you.
Ghanshyam, thank you very much.
Thank you.
Okay, and next week we have a ventilation workshop. So the flyer is circulated already on all the groups.
Please register.
And don't miss this opportunity. And it is convenient for everyone to attend. It is on Saturday evening and Sunday morning. So you have Sunday evening free for you. All the national faculties, difficult to have all this under one roof. So please make use of that ventilation workshop. Encourage your new residents or those who are practicing NSU to register. We'll close registration on 5th of July. So register fast, and it's only 1,000 rupees fees for a ventilation workshop. Otherwise, the charges are very high if it is a physical workshop. So online, it is very less charges. So please do register. If any doubts are there, they can ask. That the contact numbers are given there in the flyer. Any doubt, any problems in the registration. So thank you very much. Thank you.